In this video, we take a look at RSV, or respiratory syncytial virus, a very common viral infection of the airways in both adults and children. Respiratory syncytial virus is a virus that infects the airways in both adults and children. Although the virus can infect both adults and children, most serious infections that require hospitalization occur in children under the age of 6 months. Worldwide, about 33 million infections occur every year in children below the age of 5, with about 3 million hospitalizations and an estimated 120,000 deaths. In temperate climates, the virus causes annual midwinter epidemics, whereas in the tropics, infections occur year-round, with or without epidemics. Premature children, as well as children with heart disease and lung disease at birth, are at greatest risk. Among adults, people over the age of 65, as well as people with chronic heart disease or lung disease, and people with weak immune systems are the most vulnerable. Most people are infected with the respiratory syncytial virus by the time they turn 2 years of age. But because natural infection does not lead to lasting immunity, people can have repeated infections throughout their lives. In adults, the infection is usually a mild infection that resembles a cold with runny nose, sneezing, fever, and cough, and this lasts for about 5 to 8 days. In children, however, RSV can cause serious disease. It usually presents with a runny nose, coughing, sneezing, a decrease in appetite, wheezing, difficulty breathing, and this can progress to inflammation of the small airways in the lung, which we call bronchiolitis, or in some cases, it may cause pneumonia in children. RSV is spread by droplets from people coughing and sneezing, and from having contact with contaminated hands or surfaces that have dried nasal secretions on them. Because of this, the best way to avoid RSV infection is to avoid close contact with people and to wash hands frequently with soap or with alcohol, 60% alcohol. We should also be careful to avoid sharing eating utensils and drinking utensils. Small children should also be encouraged to wash their hands frequently, and when they return home from school, they should be encouraged to shower so as to not spread the virus to their siblings. Treatment of respiratory syncytial virus is mainly supportive, with support for breathing as well as maintenance of hydration. For premature infants and infants with heart disease and lung disease, there is a monoclonal antibody, palivizumab, which can be administered monthly during the fall and winter months to prevent serious RSV disease. There is also an antiviral, ribavirin, which can be used in serious cases. Doctors are striving to develop a vaccine for susceptible individuals, but for infants, vaccination of mothers during pregnancy might be a better approach, since infants have immature immune systems and at the same time have their maternal antibodies still in their circulation, both of which can interfere with the immune response to regular vaccines. During the latter part of 2022, we witnessed a spike in the number of RSV infections. This may have been the result of COVID-19 restrictions, which limited exposure to the virus and prevented mothers and children from developing immunity to the RSV virus. Thank you for watching the video. Like, share, leave your comments in the box below, and support the channel by subscribing. Until the next video, stay healthy and stay safe.